This is to help cue somebody really learn how to perform the hip shift before going into that foot elevated split squat. So I like to have people lined up in a staggered stance, and I'll do this one of two ways, either feet flat on the ground or the back foot up against the wall, and we'll use the wall to help kind of push us into this hip. But let's start with our feet flat on the ground. And from there, all I'm gonna have you do is shift all of your weight over onto that front foot, okay? Feet are still flat. The one important thing I want you to consider is make sure your low back is not arched, okay? You won't feel this in the right place if you're in that lordotic curve. So make sure you give me a little tuck there, and the minute you do that, you should feel this hip for sure start to kick on, hamstrings, inner thigh. So once you're here, all you're gonna do is I want you to put your hands on your hips, all right? Feel these hip bones at the front, and I want you to imagine your thigh and entire leg are stuck in cement. It's not able to move forward, backward, side, or rotate, all right? So the only movement we can do is moving our pelvis over that femur. So you're gonna have your hands here, and you are just going to rotate that pelvis towards this thigh. Another way to think about it is taking your zipper and trying to get it to turn in towards this thigh. When you do it right, you should really start to feel some inner thigh muscles kicking on, okay? So feeling that motion, coming out of it, sinking back into it, coming out of it, sinking back into it. The knee is not changing positions, the leg is staying still, and this is purely the pelvis just rotating over that femur. So the other way to do it is putting your foot up on the wall. I still like to have my toes on the ground. Same thing, you shift all that weight over onto that front leg, feel nice and heavy through the heel. And then from there, same thing, you can keep your hands on your pelvis, but another cue I like to use with people is to think about trying to push the back knee forward and the front knee back. And all you do when you do that is it causes you to do that little zipper twist. Okay, and when I do that, I really feel a ton of inner thigh on this one. All right, coming out of it, push that back knee forward and come out of it. And when I say your knee's coming forward, I'm not saying it's coming towards the camera. It's almost going down at an angle towards the ground and pushing that knee forward and coming out of it, pushing that knee forward. Okay, just to show you from the side view, you're gonna be here, shifting all that weight onto this front foot. Make sure we're not here. We wanna tuck a little bit, and then from there, all we're gonna do, turn that zipper towards this thigh and undo. Zipper towards the thigh, or using the other cue, you're trying to push that back knee forward, pull the front knee back. Push the back knee forward, pull the front knee back, and I feel a ton of inner thigh and outer hip here, along with the hamstring and quad. So go ahead and give that a try. This is really more for just feeling that motion so that we can move on to the next step, which is adding it into strengthening exercises.